Hello, welcome to Module 13, Chapter 13, Part 2. So we're going to pick this up in the middle of this and go on from there. Again, this is just two parts because it's kind of long and they're going to give you a break. So now we talked about in the first half about the spine, and now we're going to head on to hand, wrist, arm, and shoulder work-related musculoskeletal disorders. And we're going to start with one of the big ones. Carpal tunnel syndrome is one of the most well-known nerve disorders because of its prevalence on computers with mice, or is that mouses? I guess it's mice. We're becoming commonplace at work and at home. The carpal tunnel, Greek karpos for wrist, is the medical term for the space in the wrist where the nerves and tendons pass from the forearm into the hand. Carpal tunnel syndrome is caused by pressure on the median nerve as it travels through the carpal tunnel. Makes sense? There's no one cause of CTS, carpal tunnel syndrome, but one or more of the following work activities may lead to it. Using a pinch grip with your fingers. It's the pinch grip. Extreme force involving the fingers, hand, and wrist. Pressure on your hand, especially in the palm, for long periods. Repeated rapid movements of the hand and wrist. Repeated movements, where we've heard that before. Repetition. Tasks done while the hand or wrist is held in a bent or awkward position. Awkward postures. Low frequency vibration to the hand. Wearing gloves that do not fit properly. Exposing hands to cold temperatures for long periods. Using tools that do not fit the hand, requiring extreme pinch or oblique grips. Symptoms usually start gradually with frequent burning, tingling, or itching and numbness in the palm of the hand and the fingers, especially the thumb and the index and middle fingers. Some carpal tunnel sufferers say their finger feels useless and swollen, even though little or no swelling is apparent. The symptoms often first appear in one or both hands during the night, since many people sleep with flexed wrists. A person with CTS may wake up feeling the need to shake out the hand or wrist. As symptoms worsen, tingling is felt during the day. Decreased nerve conduction will impact strength, making it difficult to form a fist or grab small objects or perform other manual tasks. Tendinitis is the inflammation and irritation of a tendon. For some reason, this thing is spelled either way, T-E-N-D-I-N or T-E-N-D-O-N-itis. I don't know why they started spelling it the first way, since tendon is T-E-N-D-O-N. Anyhow, it's the inflammation and irritation of a tendon. Tendons occur largely in the arms, hands, and wrists because of the length of the tendons operating the fingers and the exposure to repetitive motions. But tendinitis can occur in any tendon group, not just the ones in your arm. When the tendon is under pressure, pain is the first tendinitis symptom to develop. This could come from lifting, playing sports, hyperextension, repeated work with the hands, or any type of manual job. In the first stages, pain usually only occurs when the tendons are under pressure. As tendinitis develops, pain will start to occur throughout the day, whether the tendon is under pressure or not. Movement is restricted. For example, if the tendinitis has developed in the bicep, the individual may not be able to extend the arm fully. Burning sensation is felt mostly after exercise or manual labor and in the morning or late at night. Affected areas: red, swollen, warm, or lumpy. Tendon sheaths may be visibly swollen. This is a sign of advanced tendinitis. Recovery: tendon and ligament damage. Tendons and ligaments do not heal as quickly as muscles. So an injured person may return to work after initial pain or inflammation subsides, but with a tendon or ligament that is not fully repaired, which can cause further damage. Oxygen in the blood is what drives the healing process. So tendons and ligaments do not have much vasculature, so they get very little blood. In other words, they don't have very many of the vascular system, cardiovascular system, in other words, blood vessels. So they get very little blood. And since blood is what drives the healing process, they're not going to heal very quickly. De Quervain's tendonitis is a condition brought on by irritation or inflammation of the wrist tendons at the base of the thumb, which causes the tunnel or sheath around the tendon to swell, making thumb and wrist movement painful. I don't know if that's what I had, because I had surgery and they cut me down here and cut me over here about 8 months ago. The doctor never said what it was, but that's at the base of the thumbs where I had the surgery, and up further up the wrist too. They cut me there to do some grafting from a tendon up there. So de Quervain's is caused by repeatedly performing hand and thumb motion, such as grasping, pinching, squeezing, or wringing. The swelling hampers the smooth gliding of the tendons with the tunnel. And that's what I had problems with. This disorder occurs inside the tendon synovial sheath when the inner liner becomes injured or inflamed. It occurs most often on the hands, wrists, or elbows. We're talking about tendinosynovitis now. It can be caused by injury, overuse, repetitive strain, trauma, rheumatoid arthritis, gout, or infection, and is typically a precursor to carpal tunnel syndrome. Trigger finger or trigger thumb are the common names for stenosine tendinosynovitis. It involves the tendons in the hands and fingers that work together to bend the fingers. The tendon develops a nodule or knot that makes it catch or hang up, causing pain and or a popping feeling. When the tendon catches, it increases the inflammation, repeating the cycle. Now, this is one of these things that I'm pretty familiar with, because I have had surgery on both my hands for trigger finger, probably 5 or 6 times. And they'll lock up something like this, and it'll be hard to get them open, and it can hurt sometimes. And I have one now that's kind of gets starting. I can feel it now. This left index finger is going to need surgery, but I got off, just like I said, I just got off surgery, so I could put this off for a while, just starting. And they can, like I said, they can be pretty painful sometimes. The surgery itself is not that big a deal, though. It only takes about 4 minutes. But one time, and it happens because you don't move your fingers at night. So it happens at night a lot of times. You're sleeping, you wake up, and you haven't moved your finger in a long time. You've had maybe your fist closed or hand closed, and you can't open it for the longest time. And one time, it was a while back, we had a golf tournament that morning, and I woke up about 3 o'clock in the morning, and I had a heck of a time getting my finger opened up. So, and I wouldn't go back to sleep because I was afraid I wouldn't be able to open up. And it was my left hand. I couldn't play golf. So that's my big experience with trigger finger. Trigger finger may start with discomfort at the base of the finger or thumb, leading to difficulty in flexing the finger or thumb. Once this condition occurs, the tendon is damaged for life, surgery being the only option. And that's obviously the case. It only got worse until I had surgery on. So there's what happens. That's pretty much where they cut at right there. And I just open that up and cut that little nodule off. And after that, it's fine. Some of those common disorders of the elbow are problems of the nerves. Each nerve travels through its own tunnel as it crosses the elbow. Because the elbow must bend a great deal, the nerves must bend as well. You can imagine how many times a day one bends the elbow. Constant bending and straightening can lead to irritation or pressure on the nerves within their tunnel and cause problems such as pain, numbness, and weakness in the arm or hand. And there's your elbow, extensor tendons, and all this other stuff in there, ulna. And that's how the nerves come down and through the elbow. And again, the nerves are always rubbing up against bones, so the sheaths are the ganglion cysts are more common in women, and 70% occur between the ages of 20 and 40. They most commonly occur on the back of the hand at the wrist joint, but can also develop on the palm side of the wrist. The cause of ganglion cysts isn't known. Most cause some degree of pain, usually following acute or repetitive trauma, but up to 35% are without symptoms except for appearance. Now, sometimes they used to take this ganglion, put your hand down on something hard and smack it with a book, and that would break it up. That's an old-fashioned remedy, so I've heard. I haven't ever seen it done. But lower limb work-related musculoskeletal disorders. These have received modest awareness, but there's some risk factors for the development. And when we're talking about lower limbs, what are we talking about? Legs, ankles, knees. The most common are hip and thigh conditions. Osteoarthritis is most frequent. Piriformis syndrome. Trochanteritis, hamstring strain, sacroiliac joint pain, knee, lower leg, osteoarthritis, bursitis, beat knee or hyperkeratosis, meniscal lesions, patellofemoral pain syndrome, prepatellar tendonitis, shin splints, infrapatellar tendonitis, stress fractures. In the ankle foot, you have Achilles tendonitis, blisters, foot corns, hallux valgus or bunions, hammer toes, pes traverse planus, plantar fasciitis, sprained ankle, stress fractures, varicose veins, venous disorders. Plantar fasciitis, that's funny, but it was about maybe a while back. My wife and I had kind of had it at the same time, and what we did was just iced it, got ice and put the arch of your foot on ice for as long as you could stand it, pretty much half an hour a day, a couple times a week. And that cured it, and haven't had it back. Patellofemoral pain syndrome, irritation to the underside of the patella where it meets the femur, both work and non-work related origins, least understood and often misdiagnosed. Caused by overuse and misuse, sudden stopping and changes in direction while carrying weight, frequent in sports and those performing manual labor, as well as those whose work involves frequent knee bending. Treatment can sometimes cause PS to worsen, which of course discourages patients from seeking treatment. Hip bursitis, a condition that causes pain over the outer part of the upper thigh. Bursitis occurs when the bursa, a small jelly-like sac that contains a small amount of fluid, becomes inflamed. There are a total of 160 bursae sacs in the human body, all located around the major joints. Most are found near the tendons around the large joints, such as shoulders, elbows, hips, and knees. Bursitis is caused by overuse or of direct trauma to the joint. Awkward standing postures can increase the risk. The knee is one of the most important joints in the body. Knee disorders, like other cumulative disorders, build up over time through cumulative exposures. They primarily consist of bursitis, meniscal lesions or tears, and osteoarthritis. And that is what a knee looks like. The patella is also, what's that patella also known as? A kneecap. And it shows the LCL, lateral ligament. I gotta get my glass on to read that. The lateral collateral ligament. The anterior cruciate ligament is the ACL. That's right there in the anterior, means the front. And the meniscus is cartilage absorbed shock in your joint. The posterior cruciate ligament also connects the femur and the tibia. So you have anterior in the front. I know it sounds kind of counterintuitive if you think that's the back, but anterior is in the front and the posterior is in the back. And other parts of the knee there. There's your tibia and femur. Femur is your thigh bone, and the tibia is your shin bone. The knee is primarily stabilized by a pair of cruciate ligaments. The ACL stretches from the lateral condyle of the femur to the anterior intercondylar area. The ACL is critically important because it prevents the tibia from being pushed too far forward relative to the femur. It is often torn during twisting or bending the knee. It's the most frequently injured ligament, ACL. You hear about that in sports and athletes quite frequently. The posterior cruciate ligament, PCL, stretches from the middle condyle of femur to the posterior intercondylar area. Injury to this ligament is uncommon, but can occur from force trauma to the ligament. The medial collateral ligament, MCL, spans the distance from the end of the femur to the top of the tibia on the inside of the knee. Because the MCL resists widening of the inside of the knee joint, it is usually injured when the outside of the knee is struck. And there's another picture to give you an idea what you're looking at there. Now, these are some risks of some of the diseases at the top, which we can't see in here because of the way it is. But what happens is I can do this, get that down to see it. All right, kneeling, the risk, extrinsic risk at the top, intrinsic risk, osteoarthritis, meniscal disorders, knee bursitis. That's the different disorders. From kneeling, you can get 3 out of the 4 of those: squatting, crawling, stair ladder climbing, lifting, carrying, moving. You can get extrinsic risk, osteoarthritis, meniscal disorders, past knee surgeries as intrinsic risk and osteoarthritis. So there's a list of things that using the knee as a hammer, you can get knee bursitis. So there's a list of the different problems you can have with your knee, or with your knee, and from the activities listed on the left hand side. Ligament injury syndrome. The most common symptom following a ligament injury is pain directly over the ligament. Swelling and bruising over the torn ligament may appear, sometimes 1 to 2 days after the injury. In more severe injuries, patient may complain that the knee is unstable or feel as though their knee may buckle or give out. One of the most debilitating occupational knee disorders is knee osteoarthritis. This degenerative disease causes inflammation within the knee joint and is accompanied by cartilage rigidity and atrophy. The deformation and damage is exacerbated during movement and weight-bearing activity, which in turn affects additional joint structures within the knee. Inflammation, bone spurs, cartilage wear, narrow joint space between the femur and tibia, and bone-to-bone contact are all signs of knee osteoarthritis. And bone-to-bone contact is something that's not very pleasant. Knee osteoarthritis continued. Osteoarthritis is the most common form of arthritis. It occurs when the protective cartilage on the end of joint bones, most commonly in the hands, knees, hips, and or spine, wear down over time. There is currently no cure for the disease. However, staying active, maintaining a healthy weight, and some medical treatments may slow progression and help improve pain and joint function. Individuals who stand or work on hard surfaces seem to be more susceptible to both hip and knee osteoarthritis. For example, janitors, road construction workers, carpet layers, and sheet metal workers all have an increased rate of osteoarthritis. Knee bursitis. Although there are 11 bursae in the knee, it most commonly occurs over the kneecap or on the inner side of the knee below the joint. Bursitis is the inflammation of a bursa sac accompanied by swelling and thickening of the bursa walls. What is distinctive for knee bursitis is that it is so common to certain industries that nicknames from those industries have been given. Coal miners have miner's knee or beat knee. Carpet layers knee. Obviously, carpet layers. Have you ever seen the old Thon Kit carpet layers? They have that device that has teeth on it, and they knee it to stretch that carpet to fit. And boy, I'll tell you, that's got to be tough on the knees. House cleaner, custodial business, housemaid's knee. 2 primary risk factors are using the knees as a hammer and kneeling on or leaning against the knee. When bursa become inflamed due to trauma, symptoms can include swelling or tenderness around the knee when pressure is put on it. This can cause pain when moving or at rest and even cause mobility issues. Jobs that necessitate prolonged standing and walking are commonly associated with workers' complaints of foot and ankle pain. The foot and ankle are flexible structures of bones, joints, muscles, and soft tissue that lets us stand upright and walk, run, and jump. Foot and ankle. The feet are divided into 3 sections. The forefoot, that's F-O-R-E, not F-O-U-R, contains the 5 toes, which are phalanges, and the 5 longer bones, metatarsals. The midfoot is a pyramid-shaped collection of bones that forms the arch. These include 3 cuneiform bones, the cuboid bone, and the navicular bone. The hindfoot forms the heel and the ankle. The talus bone supports the leg bones, the tibia and the fibula, forming the ankle. The calcaneus is heel bone, is the largest bone in the foot. And that's a picture of the foot. You can see that there's phalanges are the toes, and the metatarsals are the bones that are right behind the toes. And you see the other muscles in there. A lot of bones and a lot of ligaments and a lot of muscles in your tendons in your hands and feet. We know that. Muscles, tendons, and ligaments run along the surface of the feet, allowing the complex movements needed for motion and balance. The Achilles tendon, the thickest and strongest tendon in the body, connects the heel to the calf muscle and is essential for running, jumping, and standing on the toes. The talus bone has a shiny joint surface that allows the ankle to glide across the shiny undersurface of the tibia. On the outside of the ankle, there is a smaller, thin bone, the fibula, which helps prevent the ankle bone from shifting outward. The stability of the ankle joint depends on the ability of these bones to keep the central bone in place while the ankle moves back and forth. Foot and ankle injuries and disorders. Many foot and ankle disorders injuries have common causes, which include the feet roll inward too much when walking or standing, like this, which is called pronation. So excessive pronation is a problem. The arch is too high or it's flat, fallen arches, that's usually called. Walking, standing, or running for long periods of time, especially on hard surfaces. Being overweight gives you too much weight on your feet and knees all the time. Placing high loads on the foot, for example, jumping. Plantar fasciitis, a common cause of heel pain. The plantar fascia is a flat ligament that connects the heel bone to the toes. It is caused by straining the ligament that supports the arch, which can lead to pain and swelling. Bunion, it's enlargement on the side of the foot near the base of the big toe, usually. It's made up of a bursa under the skin. Bunions can be painful and can be aggravated by activity and wearing tight shoes. Neuroma, in the foot, a neuroma is a nerve that becomes irritated and swells up. If the nerve stays irritated, it can become thickened, which makes it larger and causes more irritation. Pain is usually felt on the ball of the foot. Corns and calluses are areas of thick, hard skin. They usually develop due to rubbing or irritation over a bony prominence. It's called a corn if it's on the toe and a callus if it's elsewhere. So a corn is just another word for callus. Toenail fungus, fungi like a warm, moist, and dark environment, like inside a shoe. A fungal infection may cause the nails to become discolored, thickened, crumbly, or loose. Ingrown toenail can occur for a variety of reasons. The sides or corners of a toenail curve down and put pressure on the skin, sometimes piercing the skin. Hammer toes, sometimes referred to as a claw toe or mallet toe. It involves the deformity of the toe where there's an imbalance in the pull of the tendons. Plantar warts are caused by a virus. Plantar means bottom of the foot, but warts can occur other places as well. They can be painful depending on where located. Sometimes they're mistaken for calluses. Athlete's foot, we've all heard of that. Common skin condition that can affect everyone, not just athletes. Caused by a fungus, most common between the toes or on the bottom of the feet. It may cause redness, itchiness, or tiny bumps filled with fluid. Achilles tendonitis involves inflammation of the Achilles tendon. If it stayed inflamed long enough, it can lead to thickening of the tendon. It can become a long-term problem or can lead to rupture of the tendon. Summary of work-related musculoskeletal disorders. WMSDs are the unnecessary consequence of not fitting the tasks or the capabilities of the person. They account for more than 1/3 of all occupational injuries and illness, making them the largest job-related injury and illness problem in the United States today. They may result from the following: physical demands of work, for example, doing the same motion over and over again, maintaining the same posture while performing tasks, or even sitting for a long time. Where have we heard that before? Repetition, static posture, layout, the condition of the workplace or workstation, for example, tasks that involve long reaches, working surfaces that are too high or too low, workstation edges or objects pressing into muscles or tendons, or equipment located in places that force the worker to assume awkward positions. They also may be caused by result from characteristics of objects handled, for example, weight, size, center of gravity, and the equipment used to move heavy objects. Sometimes when you're carrying something, it's not just the weight of it, but the size of it, even the center of gravity, awkward things make it very difficult to handle, even if it's not too heavy. Environmental conditions, for example, excessive exposure to cold temperatures. That's it for this module 13. So, like I said earlier on, this module has been open for a week ahead to overlap module 12, because module 12 is pretty short. So it gives you time. If you get module 12 finished, you want to get started on 13, give you a little extra time to do that. So that's it for now. Bye.